Providence hopes the impact on patients will be minimal. They've already hired replacement staff for the 3 days union nurses will be on strike. Last summer, a different group of Providence nurses held a 5-day strike. Both groups asked for the same things.
A strike is a very serious action.
An action 3,000 Providence nurses are now planning to take. On Friday, the Oregon Nurses Association gave Providence their required 10-day strike notice.
What we're fighting for is simple. We are fighting for our patients, and we are fighting for respect.
On June 18th at 6 a.m., they'll walk off the job for 3 days at 6 hospitals: Providence St. Vincent, Newburgh, Willamette Falls, Hood River, Milwaukee, and Medford. If that happens, it would be the biggest nurses' strike in Oregon history.
Going on strike is a last resort, but we will not accept a bad deal that simply allows Providence to continue with the dangerous and unsustainable status quo.
Nurses are asking for more money, a better nurse-to-patient ratio, and better health benefits. They've been negotiating with Providence for more than 8 months to no avail. The sticking point?
I think it's in totality.
Jennifer Burrows is Providence chief executive. She believes the benefits and wages Providence nurses receive are competitive.
Certainly saddened to receive a strike notice for our hospitals today. We have leaned in, over these past couple of days with a federal mediator to work hard to resolve differences where they were.
In response to the strike notice, Burrows said Providence would not resume negotiations until after the strike.
We are more than disappointed, given that other employers have bargained during the 10-day notice and have averted strikes.
Providence says they'll use the time to make sure replacement nurses they've hired are ready to go to avoid care disruptions for patients.
We've been clear, and so we explained that this is what this would look like. This is what this looked like at our institution that had a strike last summer.
Last June, 1,800 Providence nurses walked off their jobs at Providence Portland, Seaside, and Home Health and Hospice divisions. They were also after better pay, staffing conditions, and health benefits. After the 5-day strike, negotiations resumed. The two sides reached a tentative agreement in August. It's unclear how long this round will take.
My hope is that on the other side of this work stoppage, that we come back together and find a common ground in places that there's differences.
Burrows says the message from Providence to the public is they're there for them. She says they don't want people to feel like they can't seek care if they have an emergency situation during the strike. David.
Yeah, we'll see how this all plays out. Thank you, Catherine.